Welcome back, everybody, on this Wednesday. Glad you are watching Midday. It is Men's Health Month in June, and here to talk more about it is Dr. Peter Fisher. He's a urologist at St. Mark's Hospital. Thank you for being here. Why is this so important to talk about?
Thank you, Nisha. Men's health is crucial. Obviously, half the population are men. But men also are terrible to take care of themselves. And we need to get the message out to men and their caregivers about being more health conscious. Men just don't live as long as women, and they generally just don't take care of themselves as well. So as healthcare givers and as spouses, friends, family members, this is a great time to reach out to your men and say, hey, let's do something for our health. Let's be proactive.
Do you have those discussions when guys come in, when patients come in to see you?
Oh, yeah.
Do you say, be proactive, let's do this?
And I thank their wives if they come in with their wives, because I usually know when a man comes to clinic with his wife, it's his wife who brought him there. I think it's kind of part of our culture. Everyone's learning something more about our culture and our biases these days. But one thing that men have been taught to do is to delay health care as long as possible, to rub dirt on it, to walk it off. These are mistakes in our culture, I think. So helping people to be more health conscious, helping men to be more proactive and more vocal about being healthy is a step in the right direction.
Well, and prostate cancer, one of those things that you can't walk off. Why
That's
is awareness about that and treatment so important?
So Men's Health Month in June, I mean, lots of things to be aware of, but prostate cancer is the most common cancer in men. It's a silent killer. It is not really symptomatic until the disease is very far advanced. So to beat prostate cancer, we have to be proactive. We have to find men when their disease is containable and very treatable. Or in some cases, men have low-risk disease and can watch it for a period of time. But that's why we want to get men early to say, hey, screening is still a very valuable tool for prostate cancer prevention and prostate cancer cure.
Do you find that patients are putting off making those visits right now because of COVID-19? And what would you say to our viewers about that? Absolutely.
I think everybody recognizes that, man, if they have something that makes them sick, the last place I want to go is to the emergency room where there's going to be sick people. Our state has done a tremendous job, leadership both at the national, state level, even local hospitals and healthcare givers, about making people safe in a hospital to get care. There is this backlash of people who have avoided care and are getting more sick or even dying of diseases that are not pandemic, that are treatable or preventable. So I would say a message from a physician to your listeners is to seek medical help. The hospitals are safe places. Doctors' offices are safe places. This is a place where we are more than most recognizing social distancing, wearing masks, surface awareness, and keeping patients safe. At a hospital, for example, patients always get screened for COVID days before they have surgery as just a matter of protocol.
Dr. Peter Fisher is a urologist at St. Mark's Hospital. Everybody, if you'd like more information, also on a virtual 5K that is coming up that you can support, please go to their website, and we will link you from our website at abc4.com/midday. Doctor, thank you for being here.
Thanks so much.
Weather's after the